So in the last video we saw the anatomy of the perineum and we have finished the anatomy of the anterior abdominal wall. From today I'm going to start the anatomy of your internal organs of female. Okay, so first I'll go with the uterus. So see, uterus, it's a piriform shaped structure. So it has three layers: endometrium, myometrium and serosa. So this is your serosa, myometrium here and endometrium within. This uterus has been divided into various parts. I've already told it's a piriform shaped structure. So this part is known as the fundus. Okay, and this is your body or corpus. This part is your cornua and this part is your cervix. Okay, so this total length of the uterus is around 7 centimeter in a non-pregnant female, and weight is around 60 to 80 grams. Volume is 10 cc. All these things is in non-pregnant female. Understood? So 7 by 5 centimeter. This is your length. This is your width. And we have in cervix only we have anatomical os and histological os. This is your anatomical os, and histological os, how it is divided is, see, the uterus is lined by columnar, high columnar, and later at histological os it changes to low columnar. So this transition of high columnar to low columnar is your histological os. This area is your histological os. So the area between your anatomical os and histological os is your isthmus, which is around 0.5 centimeter. Understood? So this is about the uterus. I divided into fundus, cornua and body. Now let's see what is this anteversion and anteflexion. See, in front of the uterus, what is there? Your bladder is there. Behind is your anus and rectum. This is your uterus, like vagina and the uterus. Okay, so what is this? This is your vesico-uterine pouch. This is your pouch of Douglas or POD, and this is your vesico-uterine pouch. This is also known as fascia of de Villiers. Okay, so what is this anteversion and anteflexion? So this mainly the angle between your uterus and vagina and the cervix. So what is anteversion? Version, which has V. So this is a angle between your uterus and the vagina, which is 90 degree. So this is your uterus, this is your vagina. This is how we are going to remember VV. So anteflexion is the angle between this uterus and the cervix. Okay, there is no V, there is no vagina involved in this. Okay, so what is this? I can show it here. Uterus is this and the vagina is this. This is your anteversion. So it is a bending of the uterus over the bladder. If it is anterior, then it is anteversion. If it bends backward, this is your retroversion. Okay. Oh wait, I'm so sorry. And now anteflexion. Anteflexion is the uterus and the cervix. Cervix is this part. This angle is your anteflexion. Understood? So Now we'll see the cervix to corpus ratio. So what is the cervix to corpus ratio? The body to the cervix. So at birth, how it will be? The ratio will be 1:1. So before puberty, what happens? The cervix will be longer than the body. So that is why 2:1. But at a puberty, again here, the body will grow longer than the cervix. So it becomes 1:2. And during reproductive age, the body will obviously be more than the cervix, so the ratio will increase further to 1:3. But at menopause, everything shrinks and the ratio becomes to normal as at birth, that is 1:1. Okay, so I've already told you the layers of the uterus: endometrium, myometrium, and the serosa. Okay, now coming to the ligaments of the uterus. So let me talk about the ligaments of the uterus. I'll just show you. So this is your uterus. So what are the ligaments? You have to remember here 3 ligaments will be there: round ligament and one ligament which connects to the ovary. What are these? Ovarian ligament. Okay, this is your round ligament, this is your ovarian ligament. Okay, and there is, in the cross sectional view, you can see there is a pubic bone here. This is a cervix. There is a ligament attached to both, that is pubocervical ligament. And there is something called cardinal ligament which attaches to the lateral wall of the cervix to the arcuate ligament here, or the lateral wall of the pelvis. And there is one more ligament. So this is your pubic bone, pubic symphysis. This is your sacrum. There is one more ligament which attaches here. This is your uterosacral ligament. And here you can see there is one more ligament which is broadly over the uterus, that is your broad ligament. Okay, so how many ligaments? Broad ligament, round ligament, ovarian ligament, pubocervical ligament, cardinal or transverse or McEnroth's ligament. Okay, this is your uterosacral ligament. Okay, now let me see the blood supply of your uterus. I forgot to mention one more here. So here you know the structures. What are those? Fallopian tube, round ligament anteriorly, ovarian ligament posteriorly. So this round ligament is supplied by artery called as Samson's artery. Okay, now we'll see the blood supply of your uterus. So this is your uterus. So it has 2 blood supply. One is from the ovarian artery, which corresponds to 20% of the blood supply. The next one is your main artery, uterine artery. This corresponds to 80% of the blood supply. So here is your internal os. So at the level of the internal os, your uterine artery goes parallel to your uterus. Understood? Now I'll tell you the branches of the uterine artery. So this uterine artery, how does it divide? So it just goes like this, and then it divides into arcuate artery, which supplies your outer half of 1/3 of myometrium. Okay, after uterine arcuate artery comes your radial artery. Radial artery again supplies inner 2/3 of myometrium. After radial is your basal artery. So now And these two have taken care of myometrium. Now we are left with the endometrium. So basal artery supplies your basal layer of your endometrium. Next comes the last one, spiral artery, which supplies the functional layer of your endometrium. Okay, two branches for the myometrium, two for endometrium. Okay, so you have to remember the branch, how it branches uterine artery. Okay, now let me see the lymphatics. Here only I'll just show you. So this upper part will go to para-aortic lymph nodes, and this lower part will go to pelvic lymph nodes first and then later to para-aortic lymph nodes. We'll talk about the drainage of the vulva vagina as well. So this vagina goes to any nodes in pelvis. It doesn't have any particular node, sentinel node. It can drain anywhere in pelvis, groin, or in anorectal area. But the vulva, it goes to superficial inguinal nodes, and then deep nodes, and then goes to pelvic nodes. Vulva plus distal part of the vagina. Okay, this is the lymphatic drainage. Now let me go for the innervation. So this, whatever the viscera covering this, is known as pelvic viscera. Any viscera will have sympathetic and parasympathetic supply. So sympathetic is by your superior hypogastric plexus. That is your presacral nerve. T10 to L2. And parasympathetic, pelvic splanchnic nerve. S2 to S4. This is also known as nervi erigentis. Okay, both of this goes to inferior hypogastric plexus. Okay, this was about the anatomy of the uterus in brief. Now the other internal organ is your ovaries. So ovary is present in which fossa? Ovarian fossa. Okay, where is this ovarian fossa? See, this is your common iliac artery, which divides into internal, external iliac artery and internal iliac artery. So this fossa between these two arteries is your ovarian fossa, within which your ovary lies. Okay, so the normal size of your ovary is 2.5 to 5 centimeter in length, 1.5 to 3 centimeter in width, and 0.6 to 1.5 centimeter in thickness. Okay, so this ovary is attached to your uterus by something called as ovarian ligament. This will be a ovarian ligament which attaches uterus to the ovary. Okay, this usually is present posterolaterally at the cornu, uterine cornu. This has certain muscles and connective tissue which is covered by meso-ovarium. Okay, now let's see the structure of the ovary. It has cortex and medulla. So this outer part is your cortex and inner part is your medulla. What is this outer part as? This outer part as follicles, primary follicle, secondary follicle, Graafian follicle. So that part takes place in this. Okay, this is lined by your cuboidal epithelium. So this area has your dividing follicles which are developing, and medulla has the blood supply. This is the hilus through which the ovarian artery enters. This is known as medulla, which is rich with blood supply and connective tissue. Okay, now coming to the innervation of the ovary, it is innervated by your ovarian artery, which is a direct branch of the abdominal aorta, and nerve is by ovarian plexus, which is sympathetic. And one more thing, again, which I have told you, sympathetic and parasympathetic. Sympathetic is your ovarian plexus. Parasympathetic is your vagus nerve. And sensory is by T10. So that is why any kind of ovarian pain will be at the level of the T10, at the level of umbilicus. It gets radiated to umbilicus. Okay, this is about the ovarian anatomy. Now the last structure which I'm going to discuss is the fallopian tube. Fallopian tube, this attaches at the end, at the end of the uterus. So this is your fallopian tube. Okay, so the length of this is 8 to 14 centimeter. Understood? So let me draw the parts of the fallopian tube properly. So this is how your fallopian tube is. So this part is interstitial part, which is intrauterine. Understood? This will be close to the uterus cornua. This is your, I'm so sorry, wait. Oh shit. Okay. This is your isthmus, which is the narrowest part. Remember this, it's very important when we discuss about the ectopic pregnancy. The measurements are also important. This is 2 to 3 mm in diameter. And this is your ampulla, which is the widest part. Understood? Widest. So the diameter is 5 to 8 mm. Next comes your fimbriae with infundibulum plus fimbriae. This fimbriae has finger-like projection, so it helps in retrieving the oocyte whenever it gets released during ovulation. So I have told you this is the intrauterine part. Remaining all are extrauterine parts. Okay, so with this I will be finishing the anatomy of the internal organs. One more thing I just want to tell you here. So this myometrium again has been divided with the layers of the muscle that gets arranged in the myometrium. So it has again 3 layers: outer longitudinal, inner middle mesh-like, and inner circular. I'm just going to write here. This myometrium, the arrangements of musculature in the myometrium is like this: outer longitudinal, middle mesh-like, and inner circular. So this arrangement of the muscle helps in hemostasis during the labor, like after the delivery of the baby. They are arranged in such a way that they help in reducing the blood loss because of the contraction of these muscles. Okay, so this is about the anatomy. We'll discuss further in further classes. We'll discuss some more topics. Okay, if you like the video, please subscribe to my